Actually, not too much.
Not too much.
Really close. So I want to make this video for those people because you have a different history. You had come to me before for
Yes.
a cystoscopy with the local anesthesia in the office. I
Yes.
said, hey, everybody's coming, having this cystoscopy, or just without cystoscopy, going into operation. And in the operation, I am sure we will find some abnormal tissues because your history is perfectly fitting.
Perfectly.
But you said no. I want first.
Sure, yes.
Why? What was your comment? What do you think? It
Because
must be like this or no?
I would like to be sure what I have, and for me this was something new because I didn't realize that I have luekoplakia.
Yes.
Before that, nobody told me that.
How many years are you working on this subject?
On this I'm working more than 10 years.
Mm-hmm.
More than 10 years.
And nobody mentioned anything
Nobody
about
mentioned
luekoplakia.
yes about the bladder problem and luekoplakia and
What was your main symptom?
my main symptoms. At first it was pain during in my ureters.
Yes.
And I have and frequency.
Yeah.
And
And
frequency.
you said a right-sided pain. It's
Yes,
through the
yes,
ureters.
yes, right,
It's
yes,
radiating
yes.
through it.
Mhm.
Yeah. Okay. It's for me. If there is a problem in the bladder, I don't go instantly make fulguration. If it is a new disease.
At the beginning, these were my symptoms and also retention.
Retention.
Yes.
So
This was the first symptom when everything started. This was my first symptom, retention. I stopped urinate.
So your urine flow was weak, and you are
It
always
missing,
feeling there is
miss-
something.
The flow missed for let's say 4 hours, for half a day, or
Yeah.
I didn't remember, but I know that I remember clear that the flow is.
The bladder was
I don't-
full,
Yes,
and you
yes,
cannot
I cannot-
empty it
I
correctly.
cannot empty correctly.
And by time it gives you some pain, radiating pain, such
Yes,
things.
and during the years.
This is atypical, actually. If you say it's, some doctors you have retention, they will never think about the infection as a first option.
But after that, during the years, I have a lot of infections: E. coli, Enterococcus faecalis, and Candida, and what else? And also mycoplasma.
What? Mycoplasma?
Yes.
Okay, you have everything. Yeah. So,
But I found that I have mycoplasma maybe 2 years ago.
yeah, it's very hidden bacteria. It's in normal cultures.
It's in my urine.
Yeah.
My urine.
Yes. Yes.
Mycoplasma. The last 3 years was very hard for me because I have new symptom:
What?
water pain,
Yeah.
extreme
Okay.
water pain, and this happened after COVID, after my first COVID. After that, started on a daily basis water pain.
Yeah. This is always the same. At the beginning of the disease, it is a little different.
Yes.
A little more simple. There are on and off infections coming and healing with the antibiotics, such things. But
Yes.
then one day, it becomes continuous. Did you have continuous irritation, feeling, pain?
Yes, yes, yes.
Every day you feel that there is something inside the
Every
bladder.
day, yes, every day, and I have to wake up every night to go to the toilet,
Yeah.
and this disrupts my sleep,
Yeah.
the sleeping
Or-
process, and I'm very tired of this.
It's affecting the normal life.
The normal, yes,
Health status. So again, you came here first for a decision making.
Yes, I came for diagnosis.
Yeah.
Yeah, I want to check what is the bladder status. Do I have something?
So you find us from internet first.
Yes, from Facebook, from the group Bladder Fulguration, and my friend Veneta.
She's doing well.
Yes,
Yeah.
she's doing well.
We operated. She also did like you.
Yes. She's a friend of mine.
Yeah,
We found
maybe
each other.
you affected each other.
Yes, we
Because
affected.
maybe you are the only two ladies who came first for cystoscopy.
Really?
Maybe one or two more, but it's very rare. Because also, I don't know, but Bulgaria is close.
Yes.
Maybe it's easier to come, maybe it's cheaper to come.
Yes, it is. For us, it is not a
yeah.
problem. To be honest, in Bulgaria, for this many years, nobody told me that I need to have a cystoscopy.
Yeah.
This cystoscopy, which I had to review, was my first examination.
It's also
of the
same
bladder.
in Turkey. Nobody does cystoscopy because previously I was saying I was not doing cystoscopy because there is no solution. Even okay, you do cystoscopy. There is some infected urine. We were looking just for to rule out there is no cancer, there is no interstitial cystitis. But cancer in this age very rare. And with ultrasonography, if there is no cancer, we say okay, no need to make cystoscopy. But in Western world, they do cystoscopy. Even when they do it, they don't recognize the problem is from this luekoplakia. I have many cystoscopies. They send me, the patients send me, can you have a look? They never show the trigone. The doctor just go in and bypass this trigone part. They look to the back wall of the bladder, everything is healthy. Let's make a biopsy. They biopsy from the normal part of the bladder. And sometimes they see the luekoplakia and biopsy here. The part they have the biopsy, it was like in Veneta, it was like this. The part they make biopsy, it heals. Because
I know.
they make the biopsy.
She showed me that.
Yeah.
It is very interesting.
Yes, because they make the biopsy and they fulgurate the area to stop bleeding.
I know.
And this part heals. In Veneta, the trigone was like this. In the middle, there was a healed island. Healed island. Because it was biopsied and they were fulgurated there. So, fortunately, we learned how to do it. We understand the disease by the help of our patients. Really, I learned everything from the patients. The first, it began like this. But do you recommend to people just come for the diagnosis first?
Absolutely recommend that.
So you feel
This
inside
approach,
that this
yes.
is 100%, this is the
Yes.
disease and I have to go for it?
I think that everyone should know and understand that this diagnosis very well.
Yeah.
And that the luekoplakia is not a normal, let's say.
Yeah, it's not normal.
It's not normal to have this in the bladder.
Yeah.
And I need time to understand that and to think about this, to do my own, let's say, research.
Yeah.
And to understand that the pain which I have every day is because maybe of this luekoplakia, and this should be removed from your bladder. Because it's not normal to have exhausted pain every morning when you drink your tea or coffee or eat something. Maybe the body would like to flush this luekoplakia from the bladder, I think so, and maybe the pain is from this on a daily basis. This is my internal understanding and explanation.
Yeah,
And also I read a story that the percentage of people who have luekoplakia, after that this can be developing cancer very easily. And
theoretically, we very scared too much about it, but I have never seen in the trigone a cancer. In the other parts, yes, but in the trigone, I have never seen it because it's a metaplasia. That means change of tissue. If tissue changes to another type of tissue, it can change to a cancer tissue too. But I believe it's not a change of tissue in the beginning. Embryologically, this part is different. Because I always see the luekoplakia in the trigone and bladder neck, not in the side walls. Why? There must be a reason. Why always the infection come to the border of trigone and doesn't pass to the side wall of the bladder? The side walls are always healthy. So I believe embryologically this is a different type of tissue. So the infections are affecting this type. And this is not a metaplasia, they are already different type. So it will not turn into a cancer. But this is a social cancer. This is a, you know, it affects your life.
Affect a lot of your life.
Yeah, so
You cannot live how you want.
yeah.
Every time you have to go, you need to know where are the toilets and many things.
So it's very early now after the operation, but do you feel any difference in your symptoms? Do you feel any?
Yes, it's too early for me
Yeah.
to comment that.
And you will not be confident maybe for 2-3 months after all of them finish, and you are always there will be a question mark, there will be a scaring about will it come back, will it be again?
To be honest, my decision to have fulguration was 100%. I was sure that I will do this step as let's say as care of the problem, and we will see in the future
actually,
the results.
We were lucky that Veneta also has good results, but
Yes.
I always say the ladies from abroad have less success rate, but nowadays it is changing because the very difficult bladders finished. The first coming 50 ladies is very difficult. Now,
yes, you told me that you have from Eastern Europe, not from
Western Europe and United
the
States.
USA.
Yeah, this. But nowadays it is. I have patients from the UK too again, but they are more simple, more healthy bladders. So I wish there will be a 80%, maybe a little higher, 90% success. Your bladder was typical. Typical. The luekoplakia, the inflammation, infection. So, and our new technique, we fulgurate the bladder neck plus tribone. So we did everything successfully. I hope a good result from you.
I hope
I
to.
wish.
Thank you. I hope to.
Thank you. Thank you for sharing your thoughts with us. So having a cystoscopy before the operation may be helpful to understand the disease.
Yes.
If it is easy to come, to go back.
For us in Bulgaria, it is easy to come back.
But still, I recommend if you have serious symptoms that I am very satisfied and sure that there will be the luekoplakia, we can go directly in the operation and
the people can
at
go
one step
on that way. Yes.
Thank you. Thank you very much.
Thank you too.